Hi, this is Larry Lariosa of UCSF Student Health and Counseling. Welcome to the February episode of Sex Talk. You can access us on the website at studenthealth.ucsf.edu. Today's topics are postpartum sex and herpes. The first question is, I know most UCSF students are not also parents, but some of us are. And there are about 1 million challenges to sex after children while being in grad school. Any tips about postpartum sex, especially while breastfeeding and being a student?
Hi, this is Lisa. I'm going to try to share some, hopefully, wisdom that I have about postpartum sex. I did actually have a second child, which when some people have a first child think, how does that ever really happen? Because you have to have sex to have a second child. But believe me, it is possible. So after you have a baby, whether you're single or in a couple, most people feel that they are busier than they ever imagined they'd be. You can't barely figure out how to get yourself dressed and keep the kid clean, let alone initiating sex with a partner. When you add breastfeeding on top of this for a woman, it adds an additional challenge. Breastfeeding, although wonderful in many ways and can be quite joyful, and if you're an incredibly positive thinker, you might even conclude that you and your partner can be joyfully amused by watching milk squirt out of your breasts when you don't want it to, but it does make having a relationship difficult. It can cause vaginal dryness, which can be an impediment itself to sex. And the best thing for that is tons and tons of lubricant. I like Astroglide. People have their favorites, but don't minimize or cheap out on the lubricant. Buy what you like and use a lot of it. So the other issue with breastfeeding is that there is a baby suckling your breast many hours of the day, and many women seem to feel like if anybody else comes near them or hangs on them in any way, it's going to be a problem. So I think letting go of that is a big issue, and making the transition, if you're from your breasts being this feeding mechanism to being a sexual organ, which they also function quite nicely as, can be a challenge. Getting used to that is an issue. It gets better as time goes on and infants are nursing less and your milk gets regulated. Initially, I usually advise people to really try to do what's comfortable for them. I think that is a big key to being able to get turned on to even have sex. The other thing I recommend is date nights. And this, I want to make clear, does not mean sex nights. It means an opportunity for you and your partner to be together without the baby. People have a hard time getting sitters, but I would strongly encourage you to find someone you trust and try to either get out or send the baby to a friend's house. Some people do trades with other couples. You take our infant, we'll take yours. This works really, really well, especially if you're struggling a bit financially, to do trades for dates. The other thing is, if you absolutely can't bear to leave your child, it is possible to have date night at home. Try to do it when the baby's asleep in another room. I don't really think you can do date night with the baby in the room. One fun thing to do is to either cook a meal together or to watch your partner cook. My partner loves to cook, and I like nothing better than watching him do that while I have a glass of wine. And not to insult people who are big, strong believers in the family bed, but I think for most people, having sex with an infant in the bed is not exactly a turn on. So if you can at least put the baby somewhere else while you're having your date night, that would be a great idea. I also recommend this rule. I call it being open to persuasion, and I think this is a great rule for all couples. You don't have to agree to have sex when your partner wants to have sex, but you always have to be open to persuasion. So you may feel like a filthy, greasy-haired, milk-covered, overweight suckling bag, but if your partner initiates sex, what you say to yourself is, I can be open to being persuaded. And you're, instead of immediately turning off, I'm not having sex with you, try to be open to your partner's advances. It can be really useful throughout your relationship to be what I call open to persuasion. Let me cover some quick points. Don't rush into anything. Having sex before you're ready in mind or body is harmful to your relationship. Showering together or bathing together is nice and romantic. Don't forget about birth control. You don't want to be in the situation that got you where you are if you don't want to be there. Try to plan time alone, even if it's just to cuddle. Be spontaneous, but also plan to be spontaneous. Don't forget lubrication. Talk about your fears of sexual intercourse with your partner if you have those. And again, be open to persuasion. Good luck, and I'm happy to consult on an individual basis if people have more questions.
Great, Lisa. Okay, so our next question is, I contracted herpes from my ex-husband. I was afraid for years that I could no longer have sex after we broke up. However, I am now happily married and sexually active, but my husband has no signs or symptoms of contracting it after 5 years. There were even times we would have sex during an outbreak. Is it possible that he doesn't have it and I will not give it to him?
Thanks, Larry. So I'm going to use this as an opportunity to just sort of do herpes 101 because I think there's a lot of misinformation out there about herpes. 1 in 5 adults in the United States is infected with the herpes virus, but many people have no symptoms and do not realize that they are infected. After getting infected, most people have recurrent episodes of genital ulcers for 7 years that lessen over time. Although the infection stays in the body for many years, the symptoms or the outbreaks become fewer and fewer as time goes on. Very important to know that the herpes virus can be spread even when there are no visible ulcers or blisters. We used to think type 1 herpes occurred on the mouth and type 2 herpes occurred on the genitals. And then thankfully, people really started having a lot of oral sex, and we discovered that people got type 1 herpes on the genitals and type 2 herpes on the mouth. So although there are 2 types, they don't affect specific locations anymore. It's caused by the herpes simplex virus. The symptoms can vary widely depending on which type of virus you have, 1 or 2, and also depending whether you're having initial or recurrent episode. But again, I'm going to say this repeatedly, many people infected with genital herpes never have symptoms. So for people who do have symptoms, the first outbreak is usually the most severe. It can include multiple blisters in the genital area, and they often become painful ulcers. There may also be tender swollen lymph nodes in the groin and a flu-like syndrome. You could have joint pain, fever, headache, maybe painful to urinate. Sometimes people will have pain when they try to defecate. Men can develop proctitis, which is an inflammation of the rectum or the anus. And men who have sex with men are more prone to this complication than other patients. Then herpes goes into the latent stage. So after the initial outbreak, the virus travels up to a bundle of nerves at the base of the spine where it remains inactive for a period of time. And this is called the latent stage. There's no symptoms during this stage. Then people have recurrent episodes. But again, some people never have an initial or recurrent episodes. If people do have recurrent episodes, they will often experience them frequently, particularly in the first year. So this is when the virus travels back through the nerves to the skin surface, causing an outbreak of ulcers. Recurrent episodes tend to be milder than the initial outbreak. People will ask me, how likely is it that I'm going to get a recurrence? And there's no way to predict it. Some people get frequent outbreaks. Some people never get an outbreak at all. But we do know that over time, recurrences generally become less frequent and less severe. It's also possible to have an initial outbreak and then have a recurrence a few years after the initial infection was acquired. And this type of delayed herpes outbreak can be especially distressing to people if you never had symptoms during the initial infection, because it raises all kinds of questions about your current partner, and people are often very confused about where they got the infection from to begin with. And the fact of the matter is, you may not know. If you've been having sex since you were 17 and you get an outbreak when you're 27, anyone that you had sex with in the previous 10 years could have given you the virus. So there's something called a prodrome. As many as 50% of people with a recurrent outbreak experience mild symptoms before the ulcers develop, and this can be really helpful if you're using antiviral therapy or if you're trying to protect a partner. So these prodromal symptoms will include itching, tingling, or pain in the buttocks or hips, and can give you a sign that you may be about to develop a blister or an ulcer. Triggers for recurrence include illness, stress, sunlight, and fatigue. Grad school, anyone? In women, I would add in that menstrual periods can trigger an outbreak. People will ask me, when did I become infected? And there's really no way to know that. You can presume it if someone has a very, very severe herpes outbreak. You would pretty much presume that that's an initial outbreak. But other than that, it's pretty hard to pin it down. People want to be tested for herpes, and this is what we say here at Student Health. We can do a culture, but we can only do a culture when somebody has a blister, and the blister has to be pretty moist. Herpes cultures detects the virus in only about 50% of individuals with genital ulcers. What I tell people is, if the test is positive, you have herpes. If the test is negative, it doesn't tell you you don't have herpes. Now, there's also a blood test, which we really discourage here, because the fact of the matter is, if you've ever been exposed to herpes in your life, like if your Uncle Joe kissed you when you were 2 and he had a fever blister, you're going to test positive for the virus. But it doesn't tell you anything about your transmission rate, where the virus is, what to avoid, and whether or not you can't get reinfected from someone else. So we discourage the test here. The test is only really useful if a couple is serodiscordant, meaning you've both had the test, or if one partner knows they're positive. It can be useful to test the other person if the other person is planning on getting pregnant. One of the big dangers of herpes is to acquire it during the first trimester of pregnancy. When am I most likely to spread the virus? The risk of spreading the infection is much greater when a person has signs or symptoms of active infection, but it's still possible to spread the virus when you have no symptoms at all. Sex should be avoided anytime the genital ulcers are present, and oral sex should be avoided if there are ulcers or blisters around the mouth. So we recommend using condoms. They do help, especially if the sores are occurring under the place that the condom covers. The other thing you can do is to use suppressive antiviral medication, which will decrease the risk of spreading the infection to partners who are not affected, especially during that first year after a person becomes infected. We'll often put people on what we call suppression, where they take antiviral therapy on a daily basis at a low dose, and that really helps to limit the frequency and the severity of the outbreaks. People with genital herpes are at an increased risk of acquiring HIV because there is that opening or that blister on the skin. And it's important to get treatment right away. So if you think you have a herpes infection, call us or come in so we can either confirm it. But even if we suspect it, we will start treatment before we actually get the culture results back. It's most likely to be effective if it started within 72 hours of the first symptoms. In addition to antiviral medications, local treatments may be used to relieve the pain of a herpes outbreak. Sitting in a cool bath is helpful. Tylenol or Ibuprofen are certainly recommended. And don't forget counseling and support. I've seen many people here where the diagnosis of genital herpes really blows them away. It can cause feelings of shame, fear, and distress. And these reactions are normal, but it's important to remember it's a manageable condition. So make sure you're getting the support you need. Come talk to us, see a therapist. Remember, and I especially want to say this to this person who wrote the question, I'm really glad she went on to have another relationship, because herpes is not a reason to stop being a sexual person. You can use a condom with every sexual encounter, which will reduce the risk of herpes transmission. And that's it. Keep your questions coming. We love them, and we're happy to answer them. Tune in again in March for the next episode. Bye.